All right.
Okay, so we're getting ready to do a spay surgery or ovarian hysterectomy on a 6-year-old female intact Chihuahua who has had puppies before. So the dog has been prepped and is in what we call dorsal recumbency, meaning laying on her back with her belly in the air. And that is how we approach the abdomen for most dog and cat surgeries. She's been sterilely prepped. You can see the iodine, and we're using sterile instruments and sterile drape in order to keep everything as clean and aseptic as possible, just like you would do in human surgery. One of the nice things about animal surgery is not having to worry about being able to get diseases via the blood or bodily fluids, for the most part, from animals. There are exceptions to that, but fortunately it means that most of the aseptic technique that we use in surgery on animals is for the benefit of the dog or cat and not for the benefit of the surgeon and surgical staff. So we make a midline incision, and dogs and cats have what we call a linea alba, or a white line, if you've taken Latin, that shows where the bellies of the muscle of the abdomen come together, the thing that makes the center line of the six-pack in human bodybuilders, or those who are lucky enough to have a six-pack without doing any kind of work. And we cut through 3 layers of tissue: the skin, which you already saw, the subcutaneous tissue, which is this right here, and then the actual linea itself, which is the muscle layer, and then we're into the abdominal cavity. We make as small an incision as possible while still allowing us to safely do surgery and control bleeding and see what needs to be seen inside. So in dogs and cats, the uterus is shaped like a Y, so I'm using what is cleverly called a spay hook to isolate one of the Y pieces of the uterus and pull it up and out of the body. So using that allows me to not have to make such a big incision in order to get what I need up and out, since we're removing tissue today. So there's the ovary. There is the one uterine horn, or one piece of the Y, and there's a little band of thick tissue, the suspensory ligament that suspends or holds the ovary to the body wall right at the level of the kidney. So we stretch that in order to get the ovary and the uterus up and out of the body, and we clamp off to prevent bleeding. And then we use our sterile suture, which is the same as would be used in human surgery, in order to ligate or tie off any vessels that might bleed after we untangle the suture, as usual. And there are different types of ligatures or knots that you can use in surgery. I'm using what's called a Miller's knot, which comes from grain mills, and the millers in the grain mills that use this knot in order to tie the sacks of grain closed. It is a crushing as well as ligating, so it's also squishing down any fat and connective tissue around the actual blood vessel itself, so that nothing can slip out and start to bleed once it's cut. So then, again, we place a clamp for safety purposes to make sure that we don't have any major back bleeding. And we're going to then excise, slice, right there. So we have successfully prevented bleeding and removed one ovary. And now we have one horn of the uterus. Right here, we break down some of this fatty tissue, which is called the broad ligament. And there's a little band of ligament in there that's quite tough, so we pull that out. And then we use this to retract. I'm gonna hit be off, yeah. So we use this to retract and pull up so that we can get to the second uterine horn, which has a similar band of tough connective tissue called the suspensory ligament, holding it to the kidney on this side. And we kind of shampoo, rinse, repeat on this side, clamping off to prevent bleeding, and use the same Miller's knot to ligate the vessel that feeds the ovary and the top part of the uterus along that suspensory ligament. And it's really important when you do an ovariohysterectomy or removal of the ovaries and the uterus that you get all of the uterine tissue and all the ovarian tissue that you possibly can. If you leave any of the ovarian tissue behind, say for example clamping too high and accidentally squishing off a little piece of the ovary and letting it go back into the body, it will still produce the hormones that cause dogs and cats to act as if they are in heat, even though they are not able to actually get pregnant and reproduce. So sometimes you'll find a cat or a dog that has been spayed previously but still goes into heat and acts as if they are fertile, when in fact they are not. Okay, so we've done the same thing on that side. So I'll get rid of, so you can see that nice vessel right there. We have to be careful not to tear that. And one of the reasons that we pull and tear at soft tissue in animals is because when you stretch and pull a tube, especially a soft tissue tube like this, it skinnies down and clots on its own without having to use a whole bunch of suture to try and get the little tiny capillaries to clot. So you can see here's the Y of the uterus. It would be inside the dog but placed approximately here. Ovary, ovary, uterine horn, so the Y. And then what we call the uterine body is the stalk of the Y, and just below that where it turns white is the cervix. So we clamp above the cervix and again ligate the vessels using our friend the Miller's knot. There, so you can sort of see how that goes, and squinches down, so it is crushing the non-vascular part of the tissue as well as closing off the vascular part of the tissue. And the suture that we use is absorbable, meaning that the body breaks it down over time, not immediately, because then it wouldn't do any good, the dog would just begin to bleed again, but over the next 3 to 6 months, depending on the type of suture chosen, the body breaks down that suture and it goes away. So then the final thing that we do, now that we have removed the offending organs, is we check for excessive bleeding. And so we've got a little bit of ooze there, and that's from the muscle and the subcu that was cut. So we do the same thing on this side. If it came back bright red with clots on it, then we would be concerned that there was bleeding inside the abdomen, and that would not be appropriate, but that is all just ooze. And then we start to close. So we use the same absorbable suture, again important because anything that stays in the body permanently is technically a surgical implant. And as you know, if any of you know or have surgical implants like metal plates or pins or anything like that, or screws from having broken bones and that kind of thing, it is always slightly inflammatory to have a foreign object, even a sterile foreign object, in the body. So by using absorbable suture, we don't put a permanent implant in there that causes a little bit of chronic low-level inflammation all the time. So as fast as we cut through all 3 layers of the body wall, we now have to slightly more slowly sew them all up individually in order to preserve the strength of the body wall itself. So again, making the linea alba, or the white line of connective tissue that connects the muscle bellies of the abdomen, back together, apposed, not opposed, but apposed, so that blood vessels will grow across the cut tissue. and allow the cut tissue to heal. So the only advantage to using a small incision is that you are spending less time closing it, so the patient is under anesthesia for a shorter period of time. And aesthetically, it's more pleasing to the owner to have a little itty bitty teeny tiny scar or surgical area than it is to have a big long surgical area. But if we need to cut more open, like for a cesarean section or abdominal exploratory or bladder surgery or something that involves getting down deep into the abdomen and looking at the organs in there without lifting them up and out, you know, to be removed like we did just now, then we can make much larger incisions as needed. It just means that the surgical time is longer because the time of surgical close is longer. And as you can see, it takes almost as long to close a small incision as it does to do the actual spay procedure itself. So this is the subcutaneous tissue, or the under the skin subcutaneous, that I'm suturing back together now. And another reason for using all 3 layers separately in the closure is because each of them do different things. Subcutaneous tissue, as you saw, is highly vascular, so it brings a lot of nice blood supply to the tissue that needs to heal. And the skin, of course, is the protective layer that allows the tissue to heal without being constantly bathed in bacteria and dirt and mud, and in the case of dogs and cats, their own saliva, while they are trying to heal. Contrary to popular belief, licking your wound is not a preferred method of healing. It is cleaner than the mud or poop that might be on your wound to begin with, but it is not cleaner than just leaving it alone and keeping mud and poop from getting on it in the first place. So the closure of the skin that I'm doing is a type of closure that comes from human plastic surgery. It's opposing the skin without using external sutures. So again, they're absorbable sutures, so nothing will need to be removed. If the sutures came out of the body and were visible after the surgery was finished, they would have to be physically removed in 1 to 2 weeks. Or they would cause enough skin inflammation that the suture site would potentially get infected. And it also would allow bacteria to wick from the outside of the skin down into the inner living layers of the skin by traveling down the suture line itself, and we don't want that. So we keep everything neatly on the inside of the dog, and there you have it. She will be bikini ready in no time. Okay, that should be it.